Skin cancer can occur anywhere on the body, but it's most likely to occur to skin that has been exposed to sunlight, like the face, neck, and hands. Skin cancers are more common than any other cancers combined, and collectively, their incidence is rising faster than that of any other cancer. Basal cell carcinoma and squamous cell carcinoma are among the common types of skin cancer. They form in cells that do not make pigment. When these cancers are removed, they usually leave some scarring, and that can be discouraging to patients, especially if the scarring occurs on the face. Dr. Dino, Madonna, board-certified facial plastic surgeon at Face to Face Aesthetics and Wellness, talked to us about skin cancer and minimizing facial scarring.
Being in sunny Florida, we see a lot of skin cancers, and the three most common type are basal cell, squamous cell, and melanoma. So the particular lesion will have asymmetric pattern, so it won't be something that if you kind of look at it in two sides, they'll look same. So the B is for borders. The borders will be irregular. C is color variations, and D where the diameter of the rule of thumb is bigger than a pencil eraser. Those are your ABCs. So you're looking at asymmetry, border irregularities, and color variations. There are quite a few dermatologists that will, if something's on the face, will excise it via Mohs and then send it to me to repair it as a facial plastic surgeon. Mohs is a way of excising skin cancers, and it's typically a dermatologist usually trained in the technique of Mohs. And it's a way to preserve as much normal tissue as possible. So Mohs by definition is a technique, and its end purpose is to cut out the skin cancer. But they're usually done in areas where saving as much tissue is vital, like on the face. You know, you think about your nose, your ears, your lips, you want to try to save as much normal tissue. It's not like it's on your extremity or a place that has a lot of extra tissue that you can move around to close. So it's important to get it all, but save as much normal stuff. But then we also just see a lot of people who come in for lesions on their face because they'd rather have a facial plastic surgeon kind of do the removal and the repair. And quite often you're looking at three-dimensional defects, involving the ear and the nose, so it can involve multiple layers. We'll quite often have defects of the nose that go through and through where you have to reconstruct the lining, a support structure with some cartilage, and then cover it externally with nearby tissue. So we do quite a bit of that as well.
For more information on this story, as well as links to the specialist at Face to Face Aesthetics and Wellness, just click the Scar Repair Story link on our homepage at yourhometownhealth.com.